sir, is that fine? Can we begin the session now or we need to wait?
Yeah, no, we will begin the session, sir. We'll begin.
Yes, sir. Yes, sir. Yes, good evening, one and all. I'm Veera here from the core team. Yes, I welcome one and all to this 229th session today for the Mental Health Webinar Series 2020. I welcome our today's speaker, Dr. Suresh Kumar, as well all the other participants on behalf of the Department of Psychology, the American College, Madurai. Mental Health Webinar Series core team, as well Madras School of Social Work, Chennai, MS Chalamuthu Institute of Mental Health and Rehabilitation Center, International Client for Clinical Psychology and Psychotherapy, Indian Association of Mental Health and Wellbeing, also Psycho-Oncological Association, Turkey. So, behalf of all the sponsor, I welcome one and all to this 229th session. Yes, it's about like kind of cleansing and purifying related to maybe. Yes, to further, I request Suresh to proceed further. And prior that, like I request Akshay ma'am to give the introduction about our today's speaker. Kumar.
Thank you, Ira sir, for the opportunity. I'm always glad to introduce Suresh Kumar sir, who was one of the bestest professor in my life. And also he is a person who is committed, and he is a person, this is not a formal introduction, let me say that. He is a person who keeps learning, and one of the professor who could explain research methodology in simple terms, understanding and very practically. Such a wonderful person who is altruistic. As an example, you all know that this webinar series is all based on free for all the participants and context. I had always looked upon him for his simplicity and also for his eagerness to learn. For every topic, he makes sure he gives his fullest for all the PPT. If you see, it's the best. So I'm really glad that I get opportunity to once again listen to his the session. I'm really happy, and I welcome Dr. Suresh Kumar sir to take over the session.
Thank you, Akshay and Veera sir, for giving that opportunity to share my learnings with you all here. Very good evening, one and all, and most of the time you can see me as a proposed welcome address or maybe in the vote of thanks. And today as a speaker, I'm going to present one of the topic. I would like to give some basic information about how I selected this topic and why we need to learn about catharsis. Okay. I think we all know that for example, in behavior therapy or cognitive therapy, these are the predominantly used terms in counseling or psychotherapy, counselors or psychotherapists. And when you look at that, the different approaches, they are having many techniques. Okay, for example, in behavior therapy, systematic sensitization, systematic desensitization, and I can say that upfront number of techniques are there. And when you look at that in psychiatry or psychotherapy or in counseling, the ancient time, I can say that more than 7,500 years back. So they use different techniques. For that, they never given the term called techniques. They given the term called device. So for that device, they use the term therapeutic devices. Okay. So in psychiatrist or in hypnosis, they used one of the important device that is called catharsis. Now we call it as a technique. Okay, that is a basic understanding about it. When I was a student, of listening to my professor, when these terms comes, for example, catharsis, pre-association, dream analysis, the maximum they may give inputs regarding 1 or 2 minutes, not more than that. So it is one of the techniques used to be Sigmund Freud. That's all. Even for me, that much information only I was aware about it. But when I was teaching that personality theories, I'm talking about 4 to 5 years back, when I prepared the content for personality theories of Sigmund Freud, I found that catharsis, and one more term I come to know that catharsis. So catharsis and catharsis are two different terms. I'm not aware about it. When I was preparing, I come to know. But today, I can say even after preparation of for this content, I come to know that my existing knowledge, my earlier knowledge is only 0.01%. Now I don't know whether how many percentage I learned, but based on my instinct, it's saying that I have to know some extent better knowledge about that term catharsis. It is about introduction. And when we go through that different textbooks, they given the term catharsis under the heading of supportive therapies. We have to understand that therapies are different term that is mainly used for treating somebody else, for supporting. If, if we are planting some seeds, we have to go for a supporting stick for that plant. Likewise, when we are doing therapeutic component in our day-to-day practices or in our counseling setting, we need a supportive therapy. So these catharsis comes under supportive therapy. So other names are superficial therapy. What are the other names they given for this are called the superficial therapy. And some other book I found that suppressive therapy. So these were the other. When you want to know further about catharsis, you can search the term supportive therapy, suppressive therapy, superficial therapies. So these were the terms they discussed about these things. And mainly when we know about the catharsis, which is mostly used by psychiatrists, I can say, when it is a psychiatrist. And in psychiatric practice, we can find out that there are set of psychiatrists, they are using hypnosis. Okay, and these catharsis were widely used in hypnosis process. This is about introduction about my presentation. And I almost around the 12 to 15 sources I have gone through, and based on that sources, I just made an gestalt, that holistic understanding about the concept. Just I'm going to share that knowledge with you all. Okay, we will talk about three terms: psychotherapy and technique. What do you mean by psychotherapy? As well, very well know about it is a type of treatment given to different mental health disorders, which is widely very popular nowadays. I can say it is a treatment given to the mentally ill people. Okay, that is the thing. We all know that. What do you mean by technique? Okay, and as I said in the beginning, I given some introduction. What do you mean by technique? Okay, technique is a skill or ability. It may be in counseling. Technique means it is a skill in counseling. Therapeutic technique means skill or ability in therapy. Okay, which maybe in the field where we are working, it should be practiced by the person through the training and practice. If you want to become a effective or efficient therapist or counselor, we have to develop the skill of particular therapeutic skills. Okay, so this is about technique. Okay, and as I said, device and techniques. I am not aware about it. These devices or techniques are the same term or synonymous use. And the reason is we can say that metamorphosis, when a butterfly turned to become a egg to pupa and cocoon, and then it will come up a butterfly. Likewise, the term earlier they used term is a device, and nowadays they are using the term technique. I don't know, in the coming days we may use some other fancy terms also. So in psychotherapy, these devices were widely used, or these techniques were the devices used in 50 years back. They called that as techniques. Earlier they used as a device. Now we are calling as a technique. And what do you mean by psychotherapeutic technique? When we are discussing about technique, I said that it is a skill or ability of a therapist. If you claim that you are a psychotherapist, it is an ability of yourself, and you have to train and practice these things in the field. Suppose I feel that I'm more anxious. If I'm saying that I'm more anxious, I want to come out from my anxiety. So you must have the skill to overcome my problem. Okay, that is the ability you have in your field. That we can say that psychotherapeutic technique. There are n number of techniques are there. I will give one understanding. I'm sorry, voice is breaking. Maybe internet connection in your side, but my side is clear. Okay, I'll try to bit slower, you may get it. Okay. So regarding how many techniques are there in ASAF now? Can anyone please guess how many techniques may be there? Psychotherapeutic techniques. I will give an overview about different approaches. Psychoanalysis approaches. Psychoanalysis, Sigmund Freud, Adler, Jung, and a number of people. Those comes under psychodynamic psycho. analysis approach, humanistic approach, behavioral approach, or behavioral therapy, cognitive therapy, and gestalt therapy. And contemporary, we are having n number of therapy, new aroma, the therapies are there. My question is, among these therapy, we are having different techniques. And in the easiest way we can, I will try to make you to understand the concept. For example, I'm in a place called Madurai. If I want to reach Chennai, is there is only one way is there to reach Chennai? No, there are many other ways are there, or different perspective or different ways are. That is called method or approach. Likewise, when we have the problem, for example, anxiety, in behavioral approach also we can deal with it, or cognitive approach we can deal with it, or psychoanalysis approach we can deal with it. There are different approaches are there. Can you please guess how many techniques may be there in psychotherapy? Given some of the approaches, can you guess? I will tell you that the research what I have done recently. Now you can put your answers in the chat box. My question is, for example, cognitive restructuring. That is the one technique. Systematic sensitization, one technique. Spontaneous recovery, one technique. So likewise, how many techniques we may aware about it? 1,500. Okay, very good. So 1,500. Yeah, I'm really happy that these many techniques I'm not aware about it. Really great to know if she's having. Yes, can anyone guess other than Resma? There are many of you are participating here. My question is very simple. How many devices or techniques may be there in different approaches in psychology or psychotherapy? As of now, I have received one answer. The answer is saying that 1,500 techniques are there. Yes. You can guess. Need not be a right answer. In thousands. Okay. Good. So when I see these two answers, I can know that still if I introspect myself, how many techniques I know. I can hardly know only maybe in my hands and legs. Okay. A dozen, 12 techniques. Okay. 100. Okay. Alamo. 8 techniques only. Okay. Mama. Okay. I'll give on my research recently which I have done. In behavior approach alone, I found that when I was listed number of techniques used in behavior therapy, 115. I said there are many major approaches. Are there around 7 major approaches? If we count each one is on 100, maybe around 1,000. I think I can say there are 2 persons are very close to the answer. One is Dr. Vidya and another one is Resma. Maybe Resma may be more advanced than what I have done research. I think we can get input from her at the end of my presentation. So we have to understand that therapy is an overall perspective, and under the therapy we are having a number of therapeutic techniques. Now I move on to the topic which I am going to present today. What do you mean by catharsis? When you take a standard definition for the term catharsis, it is getting rid of unhappy memories. Every one of us, even me also wish to, maybe there are n number of unwanted memories are there, unhappy memories are there. I want to get rid of it. I want to stay away from that, such memories. Okay. Or strong emotions, someone has hurted me. Okay, I don't want to keep that incident in my mind. I want to stay away from that incident, that hurt. Okay, that process is called. Okay, when you want to get rid of unhappy memories or strong emotions, is known as catharsis. You can stay away from that. You can divert yourself, or you can express yourself some other way. For example, if someone is angry, you all may know that there is a movie which is very popular in Tamil. When the heroine was beaten by the parents, okay, then instead of showing anger to them and then eat more food, she's rechannelizing that anger and she consume more food items. So catharsis is like something we want to divert that unwanted memories, unhappy memories, unwanted emotions. We are diverting it. That is called catharsis. And when we look back to that origin of the term, where this term was originated. Okay, catharsis is the term. They taken it from the Greek word, which means purification or cleansing. Most of the time, for example, in my phone, when I will do that 100% 360-degree cleaning, I will do only at the Pongal holidays, Pongal time, or the New Year time, we will clean out. Likewise, there is a process. Catharsis is a process. Purification or cleansing that it may be anything. They are not more specific. The general meaning of is the purification. And when we look at the term, catharsis is widely used in two different areas. One is in therapy setting and another one is literature. And now I can say that some of the, you may aware about bibliotherapy. Bibliotherapy means when you have person who are immersed in reading, make the person to involved in reading, rechannelizing them, and then they may free from that problem what they are facing. These are the techniques also there. But generally, we can understand that catharsis were used in two fields. One is in therapy field, another one is in literature. And why we have to practice catharsis? So it is a question maybe there in your mind as well as in my mind also when I was preparing. The main purpose of catharsis is to bring about some form of positive changes in the individual's life. And anyone, when we talk about that the crisis time, we are having that many mental health problem. To deal with mental health problem, we can go for clinical approach or else positive mental health approach. So this is a kind of positive approach we can say. In clinical setting, they use to make a positive change in an individual. Okay. And here are some of the examples. When I go through, they found that examples of catharsis. Outburst of pride. Okay, when person is outburst of pride, it is catharsis. And rage. I think, especially one of the movie I watched recently. Yes, recently I watched one movie. The rage against vengeance against the person, and it's very very high, and then they try to express it in different modes. Temper tantrum, it is very high among the children. So these were some of the examples for the catharsis. And when we go back to that history, so who is the first person? Even though the term were introduced in ancient Greek, which were widely practiced, and the term the first used by Sigmund Freud colleague, I can say he's a mentor of Sigmund Freud also for hypnotic practices. He is the person, Joseph Breuer, a French psychiatrist, is the person who first time used the term called, first time used catharsis, cathartic technique for treatment of hysteria patients. I think you all know that these are the images you can see. Hysteria is there, widely you can find out in female, and male versions also there. When the sudden outburst of emotions, anger, aggressive will be there. And for that, Joseph Breuer, he developed a technique, a treatment for that. And now we are using as a supportive therapy, but earlier he used as a main treatment process for hysteria patients. And this cathartic treatment, what he has done, Joseph Breuer, he invited the traumatic the patients who are having mental health problem. He asked them, recall that under the hypnotic process, recall the traumatic experience what they had. Okay, under the hypnosis, he asked them, okay, when you were in a 5 years old, when you were in a 10 years old, what kind of experiences you had? And mostly our defense mechanism will never allow to go for the negative incidences. When you break through and when you release it, for example, there is a water flow is there is a block in between, the water will stand over there. Okay, if it is not moving, and it will make a problem. Okay, if it is on free flow, and we can see that there is no issue at all. Likewise here, the blocks will be removed when the catharsis, under the hypnosis, under the catharsis, the emotions will be released. And we have to understand that under hypnosis, the patients who come to for treatment of mental health problem, they are consciously expressing their emotions. These things were long-term were repressed. For example, you are having anger towards your father or anger towards your mother, but you are not having the chance to express them because our social norms are saying that you should not speak against your elderly or something, they may say that there are ethical norms are there. So what you are doing, even though every day you are seeing that unwanted behavior of them, and you are accumulating that, you are repressing, you just repress that emotions. So when we are not having that ventilating, or when we are not having that space to release it, and that will become a psychosomatic symptoms. There are many of you may aware about it. Some of them, when they scan themselves, they for that problem what they, but they found that everything is fine, but somewhere in your mind only they will say. So it is because of there are unwanted emotions are there. You have to give the space to the patients to experience, to release that emotions what they have suppressed. Okay. And Sigmund Freud also, as he said, is an colleague of Joseph Fourier. He also believed, Sigmund Freud also believed that catharsis could play an important role in relieving symptom of distress. There are many problems we are facing. When we want to come out from the problem, and we have to practice catharsis. And these are the Joseph Fourier and Sigmund Freud. They combinedly wrote a book on studies on hysteria. Hysteria is an severely common outburst of the female candidate. We can check it out. They wrote a book. In that book, they define the term catharsis. What it means? Catharsis is the process of reducing. That means it may be on a 10-point level, make it to 8 or 7 point, or eliminating the complex by recalling it to conscious awareness and allowing it to be expressed. Okay, there are some feelings are there which is you just make it allow them in the conscious mind, okay? And just recollect that in your conscious awareness and express it to somebody else. But you are, for example, on general example, if you are having different opinion with your friend, instead of saying to them, you may feel that if I say to that my different opinion to them, there is a chances are there I may lose my friendship. Okay, you are accumulating this will create a problem. Instead of that, you can release. You can say that another friend, third person, and then you can express it, and then you feel more relaxed. You are going to see that a number of benefits are there. Even now, those who are practicing Freudian psychoanalysis, still they believe that this method is the most effective method as a supportive therapy, not a main course of action. You have to understand that catharsis were used in supportive therapy, not a main course of action. And AP also, American Psychological Association also, Psychiatric Association, they define the term the same way. There is no difference. We are having the traumatic events in our life, okay, which were repressed, and it is there in our mind. We have to re-experiencing them in a consciously that will make you relief from the pain what you are having. So that is the definition they given here. And here is an example of the person who the facial expression of the people who are having the repressed emotions. So here we can find out that the people who are having that severe mental problem, and they may express it in different way, especially women, they will do this because they are not, I can say that as such now, including my family, the women are having less privilege or less opportunity to vent out that feeling. For example, if it is a male member, they can go and they are having most of them away from the family. Just think about that nuclear family. They are not having more number of friends. They may not have to express that feeling to somebody else. So when they were doing this, I think there is one movie called Charan and Snega. That movie, they very well forecasted this catharsis. And in general, I think in general, what is the meaning? I think you are got important clarity about catharsis. Catharsis is associated with the elimination of negative emotions or negative affect or the behavior associated with unacknowledged trauma. I think we may not be consciously aware about the particular behavior. That is why we are not able to express it. That become a problem for the individual. Okay, and here, so what are the benefit out of we are getting catharsis? Okay, now I'm going to tell you that a number of strategies, and what are the problems a person facing can use these things. Here you can see. And for Joseph Bruyère's original concept, there were no studies were conducted because they may not having that more information about it. But later, some of the research were done on the benefit out of practicing catharsis. Catharsis cannot be not happen only in the clinical setting; it is happening in different settings. We are going to look into that in my coming later. Here you can see some of the benefit out of practicing catharsis. We feel more lighter. For example, I'm having the pain. Okay, I'm having, for example, I'm not having that compatible opinion with my colleagues. So if I'm not sharing with them, if I share with somebody else, and then I feel very light. That means that's why many people are saying that try to share your feeling to somebody else. Vent out. Vent out. That's why we are having in a home windows. The more number of windows, we feel more relaxed. But if it is there is no air in the room, we feel more suffocated. The same thing will happen here. So when the person who practice kapha, they feel more lighter. They feel liberated. Oh, now I feel more comfortable because I said to him. Otherwise, it is there in my mind. It is ruminating for a long time. So when you share it to somebody else, when you express it in kapha, you feel liberated. And another one is you feel uplifted. Okay, yes, I'm not in that. Someone not pulling down. Okay, just I'm uplifted. They feel more peaceful in their mind, and they know that we should not react in such a extreme emotions. It's not effective one. They because they are aware about consciously, they may aware about less emotional reactive. We can find out those who are practicing kapha, and they are more self-confident. The people who are practicing are more self-confident, and few studies were found that there is a decreased physical and emotional symptoms in an individual. And there is a brightness we can see in the eyes itself. When you look at the other person's eye, that will give a clear picture about the person is normal or having any problem at all. You can able to understand that. So we can when you release that pain, what you are having, you feel more clear eyes. And we are most of them when we are releasing our pain, and definitely will be smiling, and then laugh will be come back to us, and then we are happy most of the time. These were the benefit of practicing catharsis. And catharsis can help in different problem what you are facing. I found these were the things: neglect, okay, neglect, inferiority, insecurity, rejection from the family members or society, blaming, self-blaming or social blaming, chaos in their life, burnout, it was the extreme burnout, anger, frustration, rage, activeness, helplessness, depression, hurt feeling, worry, emptiness, creative block, shame, low self-esteem, lust, loss, and separation. So these were the incidences or any of your client having these kind of problem. Okay, if they are coming for a therapeutic component, and then you can use this catharsis as a supportive therapy along with your main course of therapy. Okay. And here now another 10 minutes, okay, not more than that. Another 10 minutes, I'm going to tell you. She is the person, Ashley Brown. She has found out 16 catharsis techniques. 16 catharsis technique. Even before going through the article written by her and some other article, I never thought that catharsis can be practiced in some other way. Even we had on recently music therapy, or and one more therapy, movement therapy. So these are nothing but a catharsis technique only. Catharsis technique. And we will see identified 16 catharsis techniques. Music, punching bag. I can say one of the religious leader when I was doing my school education. I'm saying that long back. At that time, he said that his practice to me. I still remember this is one of the catharsis practice: psychodrama, art, primal therapy, relieving traumatic events, writing. We are going to see one by one. Reading literature and watching films, volunteering, psychoanalysis, psychodynamic therapy, emotion focused therapy, rituals, humor, confession, and exercise. These were the 16 catharsis techniques identified by Ashley Brown. And you look at here, the music. So everyone will agree with me recently. I think we were more connected with music after hearing the news of SBB is no more. SB Balasubramanian is no more. When we hear the news, and we were more connected to him after listening to the number of music. There are many songs. I'm not aware about these songs were sung by him. Now we were aware about consciously, he has done that. Music has a huge impact. Okay, when you feel very sad, when you listen the music of sad songs, you are very close to that. You feel very better. Okay, and there is an I think some of you may not understand that Tamil language. There is an entry by Wally. He's a poetist. When he was trying to explore or getting chances to write um, lyrics for the movies, Tamil movies. Okay, when he approached many producers and no one given the chance. And one point of time, he decided to come back to Madurai. He is from Madurai only, my native. So at the end, I think he decided, okay, today night I'm going to home because I spent more than 3 months. I'm not able to get any. Even I struggling a lot to eat food for one at least once in a day. So that is a struggle he had. During that time, he supposed to listen to music. That music, it is the lyrics of Kannadasan. He is also a very renowned poetist in Tamil Nadu. In the Mayakama Kalakama, I think if you are having, and the translated version is also there. He said that in the interview, after listening that song, he decided to stay there and then he tried to prove that yes, he can do that. So Kathasis means when we are music has a close relation to that. When you are happy, then you listen to that happy music. And nowadays, I don't know whether the present day music has a connection with it. I don't know. I think you have to do that. I think some of them are, we have to understand that some of them here, present day, those are doing a research, they have to do the research on that, the current music piece, and then mid-age, and then early ancient time, how it has an impact on individual. These things should be done. And we have to understand music as a positive feeling, positive emotions. And here the second catharsis technique is on punching bag. I think when the children were very angry, very aggressive. For example, in my family, they are very aggressive towards me. They will ask them to fight with the pillow. Okay, if someone in the classroom who has not listening to him, they are very getting angry. I told them, imagine that this is them, you can just punch it. When they do it and they feel more relaxed, okay, now they feel. Even without knowing these things, I have practiced. When I was humiliated at one of the interview, I don't want to say that where it is. I was humiliated only because of I am from here, Madurai. And they said that after naming my institution and other thing, they said that, oh, you are here for the interview. That's the way, the first incident. We can able to understand that. We can able to understand others, what their intention they are talking. The body language will help us to understand that what is the intention of that person. And their intention is try to make me away from that place. So that humiliation I had. Once I come back, I imagine those people and imagine in my mind, okay, I'm giving them same person there in interview, I'm asking a question. So that's the way I come out. So here, punching back is an realistic technique when we punch a back. And suppose we are getting anger towards somebody, we can do practice, and then it is an easiest way. It's not only for children, I can say it is for elders also. For example, many of you are here if you are not compatible, or if you are having more anger towards your husband or wife, take a punching back. Imagine their face. And punch as much as possible. And you can tell me what is your, whether you are relieved from your anger. And so you can let me know in tomorrow through my WhatsApp number. And another technique is an psychodrama. Psychodrama is a very popular technique. Okay. I think we all know that recently these things were very popular. Now I can say that the founder of humanistic psychodrama, Hans Berner is there. I can say he's a very good professor. He's a founder of that. He's one of the 20 important psychologists. He has practiced in humanistic psychodrama. Humanistic psychodrama, when we were involved in the process of, when we act, we are expressing the feeling. Okay. And those who are involved in psychodrama, many of them, they felt that they are come out from the problem. You anonymously think that in a role, mostly in most of the drama, you can find out they select a problematic person, how they suffered, and how they try to come out from the problem, and others will give an input. So these practices is another capacity practice we can do that. And artwork. Now I can say art therapy is very popular. They're very popular, and the colors which they were using for making art, creating art, are not only creating an art by just visualizing the art, by seeing the art also help us to relieve from that pain, inner pain. When you see the suffering of others in the picture, TAT test is an projective technique will help us to understand that hidden unconscious component. So when we were involved and do that, when we flow the immerse in that artwork, we may release our unwanted emotion. And primal therapy, I think we all know that every one of us, we may be abused or hurted by somebody else in our childhood. Okay, in this primary therapy, main aim is to allow the person, the childhood suffering. Okay, they just allow them to release the childhood suffering what they are having. Just say that what are the problem you had in your childhood. And when we directing them to imaginary, for example, the parents who were hurted, and imagine them who are just now they are very good persons and they are taking care of it. The only way we can, the hurt and wound, we can come out from that unconditional support and love from the same person who hurted us. So the primal therapy is nothing but in our childhood we had traumatic incidents or abuses. We just make them the conscious aware and ask them to release that pain. And another one is same, like the same here, traumatic events we had in our life. And writings, yes. Recently, I was in a group. I found that they said that writing is not only when the person who were involved in the writing, they're just putting all the things which were when they were or whatever thing they want to say that. So they are having that practice of writing, they are very good in they are releasing it. And some people who are reading, not only writing, when you're reading the writings of other people, also help us to release your pain what you're having. And another reading literature and then watching movies also help us. Yes, as I said, when we immersed, I remember that once I was taken Ponniyin Selvan. Many people said that once you've taken, you will not keep away that story. I thought that no, I used to read only small stories. That's my Zen stories or Akbar, Birbal. These were the stories are very close to me, are positive stories. When they introduced me that story, it is an eating volume, and I never thought that I can forget to take food item also. So when we were immersed, that sometimes we can connect with that imaginary where the story is saying that they given that there's some piece like hypnosis or mesmerizing, and the same thing will done in that when we are involving in reading that literature. Likewise, also when we see some of the movie, we cannot do something. Someone is there, for example, there are politicians are there, they are doing something not good for the society, and the hero is asking the question to the politician, and we feel we are appreciating. Okay, someone is there who is resembling there. And volunteering is another activity when you are someone has an horrible experiences in our life. Ask them to make a volunteering. When we help other people, our self-esteem will increase. That is the easiest way we can practice. And psychoanalysis, we all know that Sigmund Freud is the person who widely used this technique. Is also still now, Freud and psychoanalysis, still now they are using this process. Main aim is creating an awareness about the traumatic incidents, what they are, psychodynamics. With psychodynamics, they have to encourage the patients to express the past experiences and emotions they had in their life. And that's why there are some people will say it takes some particular time in a day. For example, having for eating time, okay, for personal time, for family time, we may have the timing. Likewise, you can fix a time for that. You can just vent out your emotions, but meant for that. It will help us to identify the root cause of the problem and make us to relieve from that. And emotion focused therapy. Nowadays, those who are having incompatible relationships, especially husband and wife therapy, these things can be used. You create an emotional intelligence, we can re-experience that importance of understanding others. For example, the husband and wives are there, and they are aware about what kind of hurt they made it. When you make them in the relationship counseling, it is an effective way they can understand what they have done, which will make them not do the same kind of mistake again. That will be better stepping stone for the better relationship between the couples. And yeah, I found this strategy is a unique one. And I think almost all the religions, all the culture, they are having different kind of rituals. I believe that the hearts who will be there. When you get it and when you fix it in your home frame, the lucky chance will come. Or when you make a color in your home, so the painting, the feng shui, there are many techniques. Rituals will make you feel more comfortable. When we do these rituals, when you pray that, you feel that okay, we are the problem, your emotions will be released. The mental and emotional problem will be released. We feel that more confident. So these things we can encourage them as some supportive technique for that capacity. Another one is humor. I think we had a laugh by Babu Rangarajan, one of the best sessions we had in our webinar series. I think he made everyone to express in a different way. Only thing is, we should not have a hesitation. Just express it. And this can be done by, for me, I used to go for one of the video. If possible, I will play the video after 2 slides for 2 minutes, and then if you feel it more comfortable, for me, even Vadivelu is the best person who can smile in my face. Happily, most of us in Tamil Nadu. And if you are from other state, you can take the comedy actors thing. And Mr. Bean and Charlie Chaplin, there are many other documentaries. Best one, thought we can go to the comment check. Comment check is the best one that will make us humor when we are very happy that we are releasing our emotional pain. And next one is confession. We can see in confession, it is an religious practice, especially in Christianity, they are having, without knowing it is one of the process. They are practicing it. They are practicing it. And when they do that, when they release their emotions verbally, and it's a religious ceremony, will make them to release their emotion, we feel more ease. In the beginning, I said, we feel more lighter, we are more liberated, we are feel more confident. And finally, exercise. It is not only one study, I found that 3 to 4 members, they suggested that exercise is on best catharsis technique. When you are addressing somebody else, exercise is not only good for your mental and mental health, for physical health also is very important. So we can do exercise, stretching exercises also. So these were the practices we can do that. I given only 16 given by Ashley Brown, and you can analog it and then you can come up with new ideas. You can come up with n number of catharsis ideas. That's your role, your creativity play there. So I will wind up my presentation here. I hope I given little more information than your existing information about catharsis. Even for me also, I learned many things by preparing the content. So I can stop here. Thank you so much for listening. And if you have any questions related to that, please let me know and then I will try to answer the questions. I will try to play a video for 2 minutes. Yes.
Sure, sir.
Sir, I would like to ask one question. You said that
Yes.
catharsis happens different 16 types, isn't it?
Yes.
So I had a doubt when you were explaining.
Yes.
In our temples, no, they have this. They go into the trance and they just have our this thing. Is it a catharsis? I wanted to.
Yeah, no, when we are praying, we are releasing that pain what we are having. That is a catharsis. That is a catharsis.
Thank you, sir.
Welcome. Then here is one video. We'll see for 3 minutes, then we'll continue. Can you able to see? Yes.
Yes, sir.
No. Slow down.
Be honest. Do you really want to watch a video?
Writing's not that easy, but Grammarly can help. This sentence
Yes,
is grammatically correct,
from my side.
but it's wordy.
Yes, and I hope today's session is useful for you. I feel personally, I learned many things when I was preparing the content. Thank you all for that great opportunity. If any questions, yes, comments, compliments are welcome.
It was really a wonderful session, sir, as usual. And there are a lot of new information, as you said. We got a lot of new information. We have whatever we had learned about catharsis, we were not able to relate, I think. But this one was very simple and it was very informative, which was easy also for us to understand. That way of presentation is what is very much useful for us in our life also. Thank you so much for that, sir.
Thank you.
So, participants, you can unmute yourself and ask the question, or you can type the question in the chat box so that I can read it for sir. Yes, Dr. Vidya ma'am, you can go ahead with your question.
Sure, sir.
Yeah,
Are you
yes.
able to hear me? Sir,
Yes,
as
yes.
usual, you're rocking.
Thank you.
Very good session. So, sir, my doubt is,
Yes.
so far I was thinking catharsis is about like crying out to vent out emotions.
Yes.
Today I had an insight like rage and temper tantrum is also catharsis, which is new to
Yes.
me.
Yes.
So
Yes.
regarding that only I have doubt. So
Mm.
when we say rage and temper tantrum, usually we think that is a negative thing, right? We
Yes.
usually
Yes.
say, no, control your anger or temper
Yes.
tantrum should be controlled. So today's information, it is new. So how it is like a positive thing? Is it that temper tantrum is needed for a person, or rage is also needed for a person to vent out vent out
The
their
same
emotion?
questions.
Please.
Yeah, same question I also had when I was referring the content. What they said, most of the articles, we are looking only the positive way to express our feelings and emotions, but also there are negative ways also there, and that also has an equivalent impact on releasing our pain. And for example, temper tantrum and rage are negative way to express our catharsis. And but instead of that, for example, we may know that குறள் இனிய உளவாக இன்னாத பொருள் கனியிருப்ப காய் கவர்ந்தது, which means we are having that fruit. Why should we go for a bitter one? Likewise, there are positive way we can release our emotions, and negative way also there. And instead of that, we can try to find out positive alternative. Okay? But it is not a wrong. I'll give one, for example, couple therapy. We have to allow them to express their anger towards their partner. If they are not doing so frequently, and there is one study saying that I think the very famous person who said that in a relationship it is successful only if you are having that 1:5 ratio. That means one person you must have a conflict with that person, your partner, and otherwise the relationship will not be long lasting. That's one thing. Yes, these are also negative way we can negatively we can release our emotions, but there are alternative positive emotions, positive ways also there. We have to find out. As I said, only 16 here I given. There are many techniques are there. We have to explore.
But I have, I
Yes.
have to tell one thing here.
Yeah.
So
Yes.
this rage, no anger. So I can relate it with myself because many times when I was, as you said, no, like childhood repressions, or even now, like even I'm 40 years also. Now I cannot talk back to my mom. See, I cannot express. Even if I am having some negativity towards her or she's hurting me, I will not talk back. So even now at 40 years also, this age, that is repressing, right? And even to husbands also, like we are
Yes.
80s kids, we are like grown up, like even I don't talk back to my husband also, even if he's doing back to me, right? So keeping those repressed memories, one point, sometimes, I also shout back or to somebody or whatever, that rage. After that rage, anger expression, then I feel calm.
Yes.
So now I'm able to relate it. Yes, that is also a catharsis. When you said, see, when I shout back, then I feel maybe not at my husband or my mom. Maybe I do it at my office with my subordinate. Something when they do wrong, maybe I am over, expressing there.
True.
Then I feel somewhere relaxed. So I think, yes, as you said, that is also then
Yeah, I think we
a
are having
form of
a great
catharsis.
example here. Thank you so much.
Yes. Now I was able to relate it. Okay, then that is again a form of catharsis.
Yes.
Thank you so much, sir, for your
Thank you.
new information. Definitely. Thank you so much.
Thank you.
Thank you, Vidyavam, for that wonderful question, and thank you, sir, for that wonderful answer. So we have a question from one of the participants, Anjana ma'am. So she has asked, sir, going to an astrologer is also a type of catharsis?
I think no. Maybe partially, maybe, but I cannot relate with that. When you see that technique reversion, the person who involved in it, he will express it. But here only listening, listening, getting from others. I think it's not a catharsis. I guess. When you express your feeling, there is a catharsis in any mode, any way, art or whatever it may be, dance, exercise. The person must involve. That's my understanding.
Yes, sir. Very well explained, sir.
Sir, just 1 minute, sir.
Yes.
Anjana here. So,
Yes.
if we go to the astrologer, we are telling the astrologer our problems. We are telling him whatever it is. And if it is a good astrologer, we do land up feeling relieved at the end of the session. So, I'm not saying all astrologers will land up giving you that feeling, but a good astrologer will land up giving you the feeling, whether he gives you any remedy or not, but you land up feeling very much relieved at the end of it, because you've just unburdened yourself with him. So I should have put a good astrologer there.
Okay. Now I can relate with that what you are saying. Thank you. Thank you for it.
Thank you, sir.
Yes.
So I have a view about this. Shall I share it, sir?
Yes, please.
Yes, sir. But if at all we have to go to the astrologers, if they give a negative thing about something in the future, it is going to be wrong or something, even if it is true in some sense, that time it will fire back, I guess. So from my point of view, I guess it's more not of catharsis is my point. Just I want to put both. Probably I have to research more for that to say it. Yes, sir.
Thank you.
Yes. Other questions, participants?
I think we are going to finish our session at the right time. Exactly.
Yes, that's what I was about to say. So now we will move on to the vote of thanks. So now I request either Subha ma'am or Dr. Salim sir to place the vote of thanks.
வாய் மட்டும் தான் அசையுது, ஒன்றும் கேட்கல.
I think Subhamam is not there, so shall I go ahead?
She said, but we cannot hear her.
Am I audible now?
No.
So, thank you so much, Suresh. I would like to just share a few words and let Dr. Salim itself propose the vote of thanks. And I know catharsis is one of the very important technique. We have been, I should really wanted to make a point over here. For the past, from April 14th, we have been doing a lot of catharsis through this entire process of webinar. And a lot of positive strategies, what Dr. Suresh now handled the entire session. We have covered in various aspects in that, and also we have really experienced that in our life also. So I think one of the very important catharsis this mental health webinar has been playing in your life so far, for the past few weeks during this pandemic also. So I feel it is very important to take the momentum on. And thank you so much for the wonderful session, Suresh. Over to Salim for the the official vote of thanks.
Thank you, Subha ma'am, for giving the opportunity, particularly for Suresh sir session's vote of thanks. Suresh sir, it was a very fantastic topic, and there's a learning, so much learning aspect. We learned a lot of things, and the thing is, you explained big topics in a very simplest way. So that is the beauty of the session, sir. So I can say that even as a layman also can understand the concept of catharsis in that nice way you explained very well, sir. So we want more sessions like these topics from your end.
Definitely.
So, yes, sir. So I would like to thank to all the participants and resource person on behalf of the American College Madurai, Madras School of Social Work Chennai, and MS Chellamuthi Institute of Mental Health, and Department of Psychology, Madurai Kamarajari University, and Red Pond Educational Research Center. Last but one is Psycho-Oncological Association, Turkey. So thank you all the participants for the participating in this event. And tomorrow we are going to have yet another wonderful session. So thank you one and all.
Yes, thank you all. And then we are exactly 7:00, I think. We'll meet again tomorrow. Bye-bye. Thank you all for that.
Wonderful sessions on Suresh sir.
Thank you. Yes.